My name is Jessica Pickett, and I have genetic high cholesterol. Very active life, had no health problems at all. There's no indication I had any heart problems. If anything, my blood pressure that they took ran low and never ran high. Back in college, I had some blood work done and it came back with high cholesterol. The number was over 400 and I didn't know what that meant. I had checked out and found out that's pretty bad. So I followed up with the cardiologist. We tried different statins and lipids and nothing seemed to really get it down to normal levels. I never had it below 200. And after meeting with my cardiologist, she suggested what my primary care physician suggested was to try a new medication called Repatha. In order to get this medication that insurance was rejecting, I actually had to go meet with a genetic counselor because I knew it wasn't just my health.
A lot of patients don't entirely know what will go on during a genetic counseling appointment. Some of them will come in with some information about their personal history and their family history. But what we do during a genetic counseling visit is discuss with them the reason that they're there, discuss with them the role of genetics in their family history, and try to figure out if there is a connection between their personal medical history and what's going on in the family. I think one thing neat about Jessica's story is when she came to see me, we knew already there was something going on from a genetic standpoint. We were hoping that we would have a diagnosis because of what doors would be opened up to her for medications.
Genetic testing helped prove my clinical diagnosis suspicion of familial hypercholesterolemia, and that this is a rare genetic disorder. We know how to treat her. Familial hypercholesterolemia, if not treated, can decrease life expectancy by 30 years. And by knowing what we know, we could also test her children.
We also talked about my children, which was an important thing for me. I have a 8-year-old son and a 3-year-old daughter, and she said with my son that it's time to get him tested to see if he also has the familial high cholesterol. And sure enough, we went and got his blood work done, and his cholesterol for a little 8-year-old boy was over 200.
Some people feel bad that they've passed down this genetic information down to their children, but there's really nothing you can do about that. That's just how DNA and genetics works. So for Jessica, I think it was more of a relief that, if her son also does carry this genetic risk, at least we know about it now and not much later in life when maybe medications wouldn't have the same impact that they would at an earlier age.
So meeting with KRISTEN was a great thing that we have the opportunity to do now, to find out that it isn't myself and my decisions that I make in my life, that it is genetics and is something that can be done with the help of modern medicine.
To learn more, visit us at thinkheartthinkus.com.